Today we're at Mary Washington Hospital in the Primary Stroke Center. We're going to tell you about a new state-of-the-art technology and procedure that Mary Washington Hospital can now do right here in Fredericksburg. Today I'm in the Primary Stroke Center at Mary Washington Hospital with Dr. John Muse, who's a neurosurgeon for Mary Washington Healthcare. And Dr. Muse is going to tell us about some new technology that the hospital has gotten in. So, Dr. Muse, thank you for joining us today.
Yeah, thank you for coming by. I'm happy to show off this great new equipment we have and talk about what we can do here.
Yeah, so this is new as of the past few months. So tell us about the new equipment and what you can do in here now.
So this is what we call a biplane, two big X-ray machines that go one direction, the other direction, and it's, that's a very simplified explanation of what this thing can do. It's an incredible piece of machinery. This is the top of the line. It allows us to, when patients will come in with things like a large vessel occlusion or a big stroke, to bring them in here, and we can go up and use this machine to navigate all the way from the artery down the groin up to the blood vessel in the brain that's occluded and remove a blood clot.
And I've always heard that time is of the essence with a stroke, so I assume that this procedure is very important with how the ultimate impacts on patients who suffer strokes. Is that right?
Yeah, we know that the sooner we can get them here to do this, the better the outcome is. It's a fact. And that's with every type of stroke, including the ones where we just give medicine through IV, but certainly for this procedure, there's been lots of studies going back to 2015, 2016, when the first major studies came out showing the benefit of this procedure, that time was vital in terms of that, and that the longer you had to wait, the worse the outcomes likely were.
Okay. So I'm not a doctor. Most of the viewers are probably not doctors, but simplistically, like, what does a thrombectomy do? Like, what are you able to do for someone who suffers a stroke through that procedure?
I think that in simplest terms, and the way that I like to think about it too, is that there's a blockage. You can say the plumbing or whatever. In a tube, there's a blockage, so fluid can't get past that blockage, and so I go up with a another tube, a catheter, and you go up right next to where that clot is, and then it's basically a vacuum suction, and there's also a basket I can deploy across it to help grab it, but usually it's just that vacuum suction right up next to it, and then you pull the catheter back with it inside, and that opens up the blood vessel. So that whole section of brain wasn't getting any blood flow. Yeah, and if you don't have that, it's not just that you've lost the ability to move one side of the body, and for this was on her right hemisphere, but it's on the left hemisphere where most people's language is controlled, and their right hand dominance, the left side controls the right side of the body. It's a death sentence for a lot of people.
Yeah. And patients who receive that procedure, sort of compared to those who don't, like, what are
really one of the most powerful treatments we have in medicine right now. It is without doing this treatment, the morbidity or mortality, so them having a bad outcome, is about 90%. In doing this, they can walk out of the hospital the next day.
Wow, that's amazing. And so before Mary Washington Hospital got this equipment, like, what would someone who suffered a stroke, who needed this procedure locally, like, what would they do?
We'd have to send them to one of the other regional hospitals. So, over an hour away to get there, just by transport. And that doesn't include calling to arrange it, getting transport here. And so it really, can be devastating. It can change, from them being able to have a, functioning on their own to not being able to.
Okay. And then just generally, stroke symptoms. Tell people what are the symptoms of a stroke, and if you're experiencing one of those, what you should do.
So the big symptoms people think of would be things like difficulty with speaking, loss of vision, weakness or numbness on one side of the body, typically, but they can be more subtle depending on where the stroke is. It can just be all of a sudden, nausea or vomiting, just feeling sick and having problems with their balance, things are spinning. all of these things can be a sign that you're having a stroke. So anything that comes on acutely, a big change, it's a reason that you should call EMS and have them, come evaluate you.
Okay. And you'll get patients that come to the ER, you determine that they need this procedure, and they come right in here.
Yeah, we worked out a really good, basically triage system to get people here as quick as possible when they get here. So, it all starts with EMS. EMS knows that there's different grading scales we can use, signs that they can look for that this is something that could be treated with what we call thrombectomy. They'll call the hospital, let them know that, hey, this is someone who may have a, what we call large vessel occlusion, so that we're all kind of pre-alerted in some ways. Then the emergency department physician will let the neurologist know, and then they let me know immediately, so that I'm waiting for the images to come up so I can say yes or no whether it's something to go. And if we say yes, they're right down the hallway and the CT scanner's there, we bring them straight here and get going.
And Dr. Muse, you were telling me you came to the hospital system maybe 6 months ago, and you did your training in this type of procedure, I think you said in Jacksonville, Florida. Is that right?
Yep.
Yeah.
Yeah, I trained at a very large stroke center. We did, essentially over 1 stroke a day, and about 10% of the strokes in the state of Florida.
Wow. Well, it's a great new offering. I know that everyone watching probably hopes that they're never in here, but
I hope not either.
But if they need it, it's great to
yeah.
know that it's here. So we appreciate your expertise and that it's here.
Yeah,
So,
no, I'm happy to be here.
Yeah. Okay. Well, thank you for joining us today, Dr. Muse.
Thank you.
Okay. All right. So that's going to do it for this week's edition. We appreciate you watching. Be sure to subscribe to our newsletter and our YouTube channel, and we'll keep you up to date on business happenings here in the Fredericksburg region. See you next week.